Canada saw a total of 12 cases of measles in 2023. There are already 6 confirmed cases just 2 months into this year, so the country is well on its way to matching that number, if not surpassing it. Dr. Theresa Tam says with spring break just around the corner, an increase in travel could mean even more cases in the near future. Measles is highly contagious. People who are not immune to the virus who are exposed have a 90% chance of infection.
As the numbers of cases around the world increases, there'll be an increased risk of unvaccinated or undervaccinated travelers having contracted measles, because it's a very contagious infection, and bringing it back to Canada. I think there's already a potential risk for outbreaks to occur, but we expect more importations and potentially further spread.
To be fully vaccinated, you need 2 doses of a measles vaccine. Dr. Tam says the first is most often given at 1 year old, and the second later, typically before a child starts school. Vaccine coverage has slipped in Canada, with the pandemic partly to blame.
We are at a higher risk than we were before the pandemic. So, for example, the coverage for the first dose is at about 91%. It's just over 91% at the last check. It could be slightly higher now as people are doing catch-up, but we would like to see the vaccination rate for that first dose to be 95% or higher.
The Public Health Agency of Canada says children can get the vaccine as early as 6 months, and that is something people are encouraged to discuss with their healthcare provider, especially if they are traveling. Dr. Tam says people who get a first dose early will still need 2 shots afterwards to ensure they are properly protected. Katherine Ward, Global News, Toronto.